Hi, everybody.
Engaging, or are they super boring?
No, I think they're good.
Okay.
We are live on Facebook and the recording has started.
Good morning, everyone, or afternoon. I want to welcome you to Street Drugs, Exposure to Drugs with Annie Lloyd today. I want to thank SAMHSA, who made this funding available. Also, our partner organization, not organizations, but our partner programs of Native Connections, Great Plains HPOG, and Great Plains EPI. That's also Great Plains Native Connections. So I want to thank Haley and Brooke for handling the backside of this with our Facebook Live. Today we're going to do a little bit different in that we're going to have some interactions. So if you have comments, just raise your hand and someone will unmute you to be able to speak. I want to introduce Annie Lloyd, who is Yamabushi. Am I saying that right, Annie?
You are.
A community helper, founder of Recovery Communities of South Dakota, and principal manager of Blue Turtle Door. She's providing services as community partners liaison and public health consultant. She has 28 years active in walking the red road of recovery and celebrates her more than 40 years of lived experience. Thank you for being with us here today, Annie, and I'm going to turn it all over to you.
Hey, everybody. So we're back talking about drugs. You know, what always makes me kind of laugh about this is my father worked for a pharmaceutical company for over 45 years. And we used to joke with him that he sold drugs. He never appreciated that. I grew up to do drugs, and I'm grateful that I don't do that anymore. Today, we're going to talk about street drugs and the exposure to drugs. And I want to, before we get going, Recoveries of Communities of South Dakota is, I'm the founder of it. But more importantly, what I want you to know about Recovery Communities of South Dakota is that if you have groups out there and you have a particular presentation or some training that you'd like for us to do, let us know. Reach out to myself or reach out to Stacy. She knows how to get hold of me. And we'd be happy to do more in-depth trainings and education on the stuff that we're doing. So we're going to get going on this. I have, hopefully it's not death by PowerPoint today, but I do have some slides that we'll use because I think it's more entertaining to look at some of these slides than it is my face the whole time. So getting started, street drugs, exposure to drugs. You know, when I was putting this together, the funny thing is, or not so funny, is that there are so many street drugs out there. There's Adipex and alcohol and amitriptyline and anabolic steroids, barbiturates, bath salts, benzodiazepines, betel nut, black tar heroin, Bontril, buprenorphine. I can't even say half of these. There's Calexa and chlorohydrate, clonazepam, coca leaf, cocaine, codeine, crack cocaine. There's diazepam and DOM and DXM and ecstasy and Effexor, ephedra, fentanyl, Floxa, Flexeril, GHB, hallucinogens, hash oil, hashish, hemp, heroin, hydrocodone, inhalants, kava, ketamine, khat, LSD, marijuana, mescaline, meth, nicotine, opium, Paxil, PCP, peyote, poppy, Prozac. You get the hint, right? Spice, tobacco, tramadol, wax, Wellbutrin, Xanax, Zoloft. The list goes on and on. What I tried to do was pull out about 13 drugs that I thought we could focus on today, and then try to take questions as they come up. So what I'd ask the team that's supporting me in doing this is just interrupt me as we go through this if there are questions that are coming up and folks want to know about things, okay? So let's go to what is the definition of street drugs. Well, street drugs is a drug that is taken for non-medical reasons, usually for the mind-altering effects. And drug abuse can lead to the physical and mental damage with some substances, and then dependence and addiction. So a great example is a drug well known as Special K. Special K is an animal tranquilizer known as ketamine. It's also an illicit street drug called Special K, and it's a drug sold illegally, and it was sued for its mind-altering stimulant or sedative effects. So where are we going to start? So when you use a street or club drug, we know you're taking a lot of risk. And we've got kids that are taking a lot of risk today. The drugs are dangerous, and usually there's no way to know how strong they are or what else may be in them. That's the biggest challenge of what's coming across on the streets today. We don't know what's in it. It's not back like 30 years ago and you were getting some marijuana, but you didn't know that it was. Today you don't know what it's laced with, right? Or what it's sprayed with. We'll talk about that later on. So it's even more unsafe to use them along with other substances like alcohol and marijuana. So here's a rundown of some common street drugs and the health threats that they can pose. So we're going to start off with bath salts. Bath salts, it's a designer drug, came on the scene fairly recently and became popular very fast. That may be because they were easy to get and used to. It used to be that they are hard to detect in drug tests. Not so much the case anymore. They are highly addictive. They come in a crystalline powder that users swallow, inhale, or inject. Despite their name, for those of you that I'm sure you already figured this out, bath salts have nothing in common with products that you can use for a soak in the tub. However, that's part of that confusion that comes in. They're also called plant food, bloom, cloud9, ivory wave, lunar wave, scarface, vanilla sky, or white lightning. So what type of drug is this? Bath salts contain a man-made stimulant. They're called cathinones, and they're similar to amphetamines, and they produce the same effect as amphetamines do. So they're stimulants. They increase the levels, and if you've been in the past classes that I've taught, it's all about that dopamine that's in the brain, and dopamine's this brain chemical, and it creates the feelings of feeling good, of euphoria. That's bath salts. So again, similar to cocaine and methamphetamines. However, they're likely to cause even more serious health effects than the meth that folks use. And I know that that's kind of hard to believe, but you can read for yourself the effects that it produces: violence, paranoia, agitation, hallucinations, psychosis, racing heart, high blood pressure, chest pain, panic attacks, dehydration, kidney failure, and the ultimate one of death. Cocaine. Man, cocaine's been around a long time. Cocaine comes in a bunch of different forms. Users can snort the powder through their nose or inject it through their bloodstream. Crack is a crystal form of the drug, and that's smoked and absorbed through the bloodstream through the lungs. So what's it called? Cocaine is also known as blow, bump, C, candy, Charlie, coke, crack, flake, rock, snow, or the old favorite, toot. What type of drug is it? Cocaine is a highly addictive stimulant, again, made from the coca plant. Crack cocaine is even more addictive than cocaine itself. What kind of effects does cocaine produce? Again, it triggers the brain to release the dopamine and creates a euphoric feeling. The high is intense but short-lived, and that leads people to that leads folks to use it repeatedly and to try to keep the feeling going. That's the biggest challenge with these stimulants is that once people hit that high and that dopamine's released and that brain gets going on feeling good, man, they just want more and more and more and more of it, right? So it increases the heart rate, high blood pressure, increases the body temperature. Again, remember back when we were talking about meth, that increased body temperature, that oftentimes leads to these big super challenges of like strokes or heart attack. Get stomach pains, nausea, loss of appetite, malnourished, heart damage, heart attack, stroke, death, loss of smell, nosebleeds. Get higher risk for HIV and hepatitis due to sharing needles or other drug equipment. And then when you're pregnant, it can cause a spontaneous abortion. It can cause low birth rate, birth defects, and the baby can be born addicted to the drug. So moving right along to the next one, MDA or Molly's. So MDA, also synthetic drug, alters the mood and perception. So your perceptions being that the awareness of your surroundings and the objects and the conditions that are around you, right? It is chemically similar to both stimulants and hallucinogens, producing that feeling of increased energy, increased pleasure. You feel like it's described as emotional warmth. And then on the other end of it, you get this distorted sensory and time perception. One of the big challenges with Molly's, and you can see, is that, man, I remember cases that came up, DEA brought up around Halloween and kids getting into this, thinking that it was candy. Super dangerous being around kids for obvious reasons. So let's talk about how MDA affects the brain. Again, it increases the activity of 3 brain chemicals. This time I put it in more of the medical terms. So it increases the dopamine. Remember, dopamine produces that increased energy and activity and acts in that reward system to reinforce behavior. So the more of it you take, the more of it you want. So you also get the increased in the and that increases the heart rate and blood pressure, which are particularly risky for people with heart and blood vessel problems. And then you get the increase in serotonin. And serotonin affects your mood, your appetite, your sleep. It also triggers hormones that affect sexual arousal and your ability to trust. The release of the large amounts of serotonin likely causes the emotional closeness, that feeling like, you get around somebody, it produces this effect that people describe as you just met somebody, but you feel like they are your best friend. You want to cling to them, that emotional closeness. And then it elevates the mood and then there's also it's described that there's this increased empathy that people feel when they use MDA. So what are the overall health effects? So the health effects include nausea, muscle cramping, involuntary teeth clenching, blurred vision, chills, sweating, and MDA's effects can last about 3 to 6 hours, although many users take a second dose as the effect of the first begins to fade. So over the course of a week, Following moderate use of the drug, a person can experience then irritability, impulsiveness, aggression, depression, sleep problems, anxiety, memory and attention problems, decreased appetite, decreased interest and pleasure from sex. It's even possible that someone with these effects may be due to the combined use of MDA with other drugs, especially marijuana. So what are the other health effects of MDA? High doses of MDA can affect the body's ability to regulate temperature. This can lead to a spike in body temperature that can occasionally result in liver and kidney or heart failure, even death. Additionally, because MDA can promote trust and closeness, there is this, folks can end up engaging in really unsafe sexual behavior. So there's problems with the increased propensity for HIV and AIDS, in the transmitting of HIV or AIDS, or even hepatitis. The other big challenge with MDA, as with several of these drugs that we're talking about today with the stimulants, there's no specific medical treatment for MDA addiction. Some people seeking treatment for MDA addiction, they've found some success with behavioral therapy to be helpful. Scientists are still researching to figure out or to determine how the effects of or if there are any treatment options for addiction to MDA. Now, as with some of these stimulants, interestingly enough, MDA has been used in therapy to help people. So it was first used in the 70s as an aid in psychotherapy. So, treating mental disorders when they were using talk therapy and trying to, it's described by psychotherapists as helping people to move from their head out of the obsessive mind into that heart space. The drug did not have the support of clinical trials or approval from the U.S. Food and Drug Administration. In 1985, the U.S. Drug Enforcement, the DEA, labeled MDA as an illegal drug with no recognized medicinal use. However, some researchers are continuing to seek where there is a value in psychotherapy, and more people are talking about it in psychotherapy, but and currently MDMA is in clinical trials as a possible treatment for PTSD, for anxiety in terminally ill patients, and for social anxiety in autistic adults. Interestingly, the FDA gave MDMA assisted psychotherapy for PTSD as breakthrough therapy designation. And I suspect that there will be more coming out on that in the near future. So I just want to take a moment. I'm going to stop sharing because I've been running through this kind of quick. And I will turn my video back on. And are there any questions that are out there? So there's a Facebook comment that peyote is not a drug. Yes. Peyote is considered to be a sacred element, and this is where we get into cultural challenges with the DEA and FDA, and that the existing forces that are out there consider peyote a drug. I'm not advocating that, just pointing it out for this presentation. Any questions out there that somebody would like to unmute themselves or put a question up on Facebook? Not hearing anything, we'll go back to sharing the screen. All right, next drug we're going to talk about is one that you may not have heard of. It's called Flakka. Oh, I think we have a question. Brooke, do you want to unmute yourself and ask the question?
Thank you, Annie. I just have a question that came in from Facebook regarding bath salts. Basically, it says that they seem to be heavily used years ago, and are they still widely abused?
It depends on the community that you're in. And, you know, bath salts are still going through the community. So interestingly that people are asking the question right now, because we're going to talk about Flakka. And Flakka is similar to bath salts. It's crystal that people use, eat, snort, inject, or vaporize using an e-cigarette. So the interesting thing about a lot of these street drugs is they find new and different iterations to come back into the community and be used. You know, if you're a drug dealer, you want to find different drugs that people are going to buy and then use repeatedly, get hooked on, because that's your marketing, right? And the easier it is to get young folks hooked on it, the more money you're going to make. And in particular with the advance and the popularity of e-cigarettes, the use of bath salts in some form or another has made its way back to different communities. What goes on in South Dakota sometimes is behind the scenes, but it's not that it's not available around the community. And of course, if you travel to larger metropolitan areas, even Sioux Falls, you're going to see an uptick in things that you may not always see in Rapid City. We have a drug coming up that I'm going to talk about later on that is highly addictive and used in an incredible amount in Russia, but it's not been seen in the US recently. But knowing about these drugs that are out there, I think is important for the education. I hope that answers the question. If it doesn't, ask it again and I'll do my best to provide a better answer. So Flakka. So Flakka is another designer drug. And as I said, it's a crystal that folks use to eat, snort, inject, vaporize using an e-cigarette. It may also be referred to as gravel because of the way that it looks. It also contains this synthetic kaolin. The effects of it are similar to a stimulant. However, Flakka has known to be cause paranoia, hallucinations. It can lead to violence or self-harm. It's been linked to deaths due to heart attack, suicide, kidney damage, or kidney failure. Next one, heroin, a drug that a lot of us have heard about over the years, I suspect. Heroin comes as a white or tan powder or a black sticky substance known as black tar heroin. And users inject it, inhale it, or smoke it. Heroin is an opioid. It's made from morphine, a natural substance taken from the seed pod of the various opium poppy plants grown in Southeast and Southwest Asia, Mexico, and Colombia. Heroin, like I said, it can be white or brown powder or a black sticky substance. It's also known as Big H, horse, hell dust, and smack. People inject it, they sniff it, snort it, or smoke it. Some people mix heroin with crack cocaine, and when it's mixed with crack cocaine, it's known as a speedball. The effects are heroin. So heroin enters into your brain rapidly, and it binds to those opioid receptors on cells located in many areas, and especially in those areas that involve that feeling of pain and pleasure, and in controlling your heart rate, sleeping, and breathing. Thus, as you're going to figure out, is one of the reasons why overdose on heroin is almost an inevitability for anybody using it. So prescription opiate medicines such as oxycodone and Vicodin have a similar effect to heroin. And research suggests that the misuse of these drugs may be what opens the door to heroin use. And data from 2011 showed that an estimated 4 to 6% of folks who misuse prescription opiates eventually switch to heroin. And 1 in 3, about 80% of the people who used heroin first misused prescription opiates. 1 to 3, more recent data suggested that heroin is frequently the first opiate people use. In a study of those entering treatment for opioid use disorder, approximately 1/3 reported heroin as the first opiate they regularly use to get high. So what are those short-term effects of folks using heroin? So the folks using heroin, they report this, like they get this rush of this pleasure. So we talked about how the brain gets affected by meth. So with heroin, it's this warm and almost automatic rush because, of course, so many folks are shooting up heroin. There are other common effects as well. And some of those side effects can be dry mouth, warm flushing of the skin, heavy feelings in the arms and legs, nausea, vomiting, severe itching. Their mental faculties get super clouded. They get into this fog. And then you also, the nod, right? Folks using heroin, you'll observe them. If you ever have a client using it, there is this behavior of what we call nodding out. All of a sudden, they're just not there, and it could be conscious or even semi-conscious, or ultimately fall unconscious as a result of their use. The long-term effects of using heroin, of course, insomnia, the collapsed vein for the folks that are injecting it, the damaged tissue inside the nose who are sniffing it or snorting it, infection of the heart lining and the valves from abscesses, constipation, stomach cramping, liver and kidney disease, lung complications, including pneumonia, mental disorders such as depression and antisocial personality disorders, sexual dysfunction for men, irregular menstrual cycles for women. Other potential effects: heroin often contains additives such as sugar, starch, or powdered milk, and that can clog the blood vessels, leading to lungs, liver, kidneys, or brain, causing permanent damage. Of course, also sharing the drug equipment can have the increased risk of contracting infectious diseases such as HIV and hepatitis. So, with a heroin overdose, can a person overdose on heroin? Yes, we already discussed that. A person can overdose on heroin. A heroin overdose occurs when a person uses enough of the drug to produce that life-threatening reaction or death. Most often, the breathing stops. And heroin overdoses have increased in the recent years. When people overdose on heroin, their breathing often stops or slows. This decreases the amount of oxygen that reaches the brain, and that condition is called hypoxia. Hypoxia can have short and long-term mental effects and effects on the nervous system, including coma and permanent brain damage. So you ask, how can a heroin overdose be treated? That's where naloxone comes in. That's that medication that can treat an opiate overdose when given right away. And it works by rapidly binding to those opiate receptors and blocking the effects of heroin and other opiate drugs. Sometimes you got to give more than one dose of naloxone to make sure that the person starts breathing again, which is important why you got to get the person to the emergency department or to a doctor immediately. So you give the naloxone at the same time, either you or somebody else is calling 911 to get paramedics, get them to the doctor as soon as you can. So we already said we know heroin is addictive. Heroin is highly addictive. And for people who use it regularly, they often develop this tolerance. And that tolerance allows them that, one, they can use higher amounts and often they need it more frequently. The interesting thing about heroin is I have known people who have used heroin for more than 25 years. I don't know that to be true other than maybe the use of marijuana and alcohol. So it's an interesting drug for a lot of folks. And can heroin be treated? Can the addiction be treated? So for those who are addicted to heroin and they want to stop using it, when they stop using it abruptly, oftentimes there are severe and significant withdrawals. The withdrawal symptoms can be as early as a few hours, or it can take a while after the drug was used. And it can include restlessness, severe muscle and bone pain, sleeping problems, diarrhea, vomiting, cold flashes, which is where, so with those cold flashes, you get these goosebumps. That's where the term cold turkey actually comes from. You get uncontrollable leg movements. So that's where the term kicking the habit comes from, if you're wondering. And then you also get the severe cravings for wanting to do heroin again. And then the question about how is it treated? So there's a big, long range of medicines that are used and different behavioral therapies that can be used. And you got to really take each person one at a time. There's not a silver bullet for folks. Some of the buprenorphine is being used, and methadone has been what's been frequently used for heroin treatment for years and years and years. So I see that we have more questions coming up, so I will pause this and stop sharing and take some of these questions. What do we have? Anybody want to ask away?
Yeah, Annie, this is Stacy. So I guess, and I mean, I have my own theories on this, but I'm interested in what you have to say about it. If the pharmaceutical companies and physicians know that some of these medications can lead to addiction of street drugs and whatnot, why are they, like, how do they even get through the FDA? Why are they prescribing them? Like,
yeah, it's such a great question. So a number of years ago, oh man, maybe even 20 years ago now, there were many lawsuits about not getting enough pain management addressed. So, and through that then came this concern about being sued. Doctors had a concern about being sued for not managing pain. And then we had this uptick of the opiate prescriptions and folks making an, I showed in the last classes, down in Kentucky, you had like 70, it was an innumerable amount of prescriptions going out for all the folks living down there. The challenge is we have a belief in the United States that if you have an ailment, you got to have a pill for it. You got to have a fix for it. And the reality is that so much of the hurt, so much of the pain that is real for folks, there are other means and methods of managing pain outside of these super addictive drugs. The challenge is that it takes more time for the physicians to engage with their people. It takes more members of the team to be engaged. So for instance, if you have exacerbated back pain, and then you end up with some spinal stenosis, so it's the closing in of the spinal column, of the spinal cord around the nerves, and you get this shooting pain down your legs. Oftentimes people are prescribed like gabapentin for that, for the nerve pain, and then they're given like some hydrocodone or Vicodin for the other pain. And the reality is that if you're on that for more than 6 weeks, the effectiveness of it just really, all it does is condition the brain to want more and more and more. We know that there are surgeries available for it. So there's the challenge with the insurance companies and Medicaid and Medicare and paying for that. There is incredible opportunities through physical therapy. And physical therapists today are not just moving your limbs around in ways that often cause pain. They have so many different available tools in their arsenal of their tool bag today that folks don't even realize. And so there's this disconnect that's happening in our communities. The interesting thing about the NUCA model that like Oyate Health Center is embracing, and it's shown all this effect up at South Central Foundation up in Alaska and other really progressive healthcare facilities that have embraced this notion that we want to treat our people with the least amount of pain meds that there are, is using drugs, even injections that can go right to the pain. Sometimes they use anesthetic injections to limit the pain, using steroids to decrease the inflammation. It takes more time, and it takes an education within the culture to say, I want to figure out how to do this without using significant mind-altering substances. So I'll speak to my own personal experience with it. I've been clean and sober of any drugs, no prescriptions, no alcohol, anything for more than 28 years. I have some significant physical challenges, and I've learned how to deal with those over the years through, be it foods that I eat or the exercise or doing yoga or an ongoing relationship with the physical therapy, massage, taking Tylenol or Advil, utilizing ice. I use ice oftentimes to reduce the swelling, using heat to increase mobility. Just taking a walk every day is an amazing tool. Learning how to breathe, doing meditation. All of those techniques begin to develop a tool bag where we can lean in and understand that a little pain isn't going to kill us, even some significant pain, but oftentimes our solution to addressing that pain can cause us severe challenges. So I don't know if that provided a succinct answer for you, Stacy, but that gives you some insight into it.
It does. And I have a part two, but another question, and I don't mean to monopolize the time, but I noticed that a lot of Indian Health Service now, they're not prescribing like hydrocodone and things, but instead they're using tramadol. Can that not be just as addictive?
Yes. Tramadol, it was considered to be not as addictive as others, but it can be just as addictive. I really believe that there are standards when we look outside of the United States and we look at what other countries are doing, particularly in Sweden and Denmark and Netherlands and even Portugal, and looking how they're dealing with Germany. Germany is a huge utilizer of homeopathics. There are so many traditional and alternative ways of dealing with pain that are not utilized here in the United States. And we work so much in silos. So you have a medical doctor or a surgeon, and they're not engaged in a whole team of folks, from behavioral therapists to, again, physical therapists, even speech pathologists. There are so many folks that are out there. Engaging a good massage therapist in with the practice, engaging great mindfulness practitioners in with there, because all of that can play a role in helping people heal. our body holds the trauma. We've said this over and over and over and over. And when we're talking about these challenges within Indian country, what we know is that inside of us, we have this trauma we've come into the world with from historic trauma. And we experience it on a regular, ongoing basis through colonization and oppression and institutional bias and racism. Also within us, that is not often invoked or elevated to the extent that it can be, is the healing resilience that we have within us. And so when we can begin activating that resilience, when we can begin activating that healing that we have innate within us, it is amazing. Even if it's just sitting around the drum, even if it is, signing on to social distancing powwow and listening to the sound of the drums, watching the colorful regalia of our relatives dancing and experiencing that joy that we witnessed during that, all of that produces that dopamine response as you get with the opiates. However, it doesn't have the side effects that go on with it. Laughing produces that dopamine response. Being around a puppy, if you're a dog lover or you're a cat lover, or you have, grandchildren that you love being around, again, that increases that pleasurable sense of euphoria in our brain. And it's really attending to that more frequently to increase that. Does that help?
Yes, thank you.
You're very welcome. So I see that, what is a designer drug? So a designer drug would be something that is created in a lab. It is not something that is naturally produced in nature. So heroin comes from poppy, right? So heroin's not a designer drug. The others are these formulations, and we'll get into a couple of drugs down here, like crocodile. You have no idea what is in there. There can be alcohol that's in it. It can be a whole combination of stuff. I remember back in the 80s when I started working in this, when they were making crank, there was everything from some meth that was in there, but also it was combined with, everything from the Bon-Ami cleaner and all these different chemicals, and all produced, and they'd mix it up in a bathtub. It was just nasty stuff. Any suggestions if someone is looking for help on substance use treatment? Oh gosh, that's a really long question. And we've talked about the availability of treatment within Indian country. There are a number of different treatment centers. It takes some time to sit down with somebody and ascertain what is it that they really need and what is it that's really going to work best for them. There's everything from equine therapy, assisted therapy available out there. There are places like, there's a place out in Washington State that is really amazing and has a certification from Native Americans in recovery. There's a couple places. There's a place up in Utah, Idaho area, some up in Montana. It really depends on sitting down and having a conversation with somebody. There are not nearly enough treatment centers for our population as there are the paid treatment centers. There's a lot of paid treatment centers. We got to remember, when we think about treatment is really, right now, for the most part, with the exception of very few facilities, is a stopgap measure. It is a place for people to go and have the behavior of using be interrupted. It's not a long-term solution. Long-term solutions come in the matter of beginning to heal yourself. That's what step work, or working the folks with 12 steps, working with a cognitive behavioral therapist, working with a recovery coach, that helps you identify within yourself the challenges, the hurts, the trauma that brought you to a place that you wanted to use substances, mind-altering substances, mind changers, for that effect that it produces to get you out of whatever is going on. it's a long-term, lifelong challenge for folks. Many kids, so one comment is, many kids I have been working with, I have seen an increase in LSD and mushrooms. Yeah, I have that later on here in the presentation. There is. Can we please get a copy of the PowerPoint? Yep, that's being taken care of. Is methadone as bad as meth or other drugs? Gosh, yes, in my opinion. Others would disagree with me emphatically. So when medical assisted treatment became a thing, MAT came after the beginning of methadone. Methadone was really the first course of action with medically assisted treatment. Actually, you know, I can remember back with alcohol use back in the early 80s, we'd prescribe people drugs like Librium and Valium to come off significant alcohol DTs. What I've seen with long-term methadone use is people losing their teeth, having challenges with the same challenges that they have, just not to the same extent that they often do with heroin. I have some really dear friends that have been off heroin and meth for a very long time now. They're at 30 years and clean and sober. The irony is that they were long-term heroin users. They got put on methadone to get off the heroin and eventually ended up using heroin again to get off the methadone. And all 4 of these folks that I know have had to have their teeth replaced and have some long-term ongoing physical challenges as a result. So I hope, yes, Michelle Moore put up a healing lodge, exactly. We have to remember that this term addiction and folks getting addicted to drugs. So there's one, the physical aspect of our physical body becoming addicted to this. Our brain wants more and more and more and more. There's also the emotional, spiritual, mental challenges that we go through because we're not getting what we need to have met to heal us. And, you know, it can be that we don't feel comfortable in our own skin because of different challenges. And so it really does take a healing, what I call it, and I've coined this phrase from many that have come before me, this healing forest. And that healing forest experience is only going to take place when we can have a healing circle that builds out to a healing lodge, and then we experience the healing forest. I hope this has been helpful. If there's more questions, again, please put them up there, or any of you, Brooke or Stacy, or any of y'all, please interrupt me. Do we have any other questions before I continue on? Okay, so I'm going to share the screen once again. And I have a short video that I'd like to share with y'all that is just a short little video about heroin and cocaine. Hopefully, if I can get this to do this. Maybe I can't. Okay, so we'll just move right along because that doesn't seem to be working today. All right, let's go to this drug that I was talking about called Crocodile. Crocodile is this crazy, nasty, nasty drug that is available primarily in Russia, and it is nasty. So it's typically used by IV. So people, are shooting it into their veins. According to the reports, the drug is fast acting, so it acts within 2 to 3 minutes. And it is 10 to 15 times more potent than morphine and 3 times as toxic. So when the toxic chemicals are removed, quite often what is left is a drug called desomorphin, and it's a compound very similar to heroin. So after this rapid onset, the euphoric feelings can last less than 2 hours. And due to this short period, this short duration of the high, many of the users keep putting more and more of the drug inside of them to avoid the withdrawal symptoms that are as significant or even more significant than that of heroin. So remember, kicking heroin, all of these different terms came from, the withdrawal symptoms of heroin. So due to the drug's rapid onset, but short duration of action and frequent administration, there is this physical dependence that occurs almost immediately within the first use of it. So you can see that comes out of this crocodile drug, ulcers and sores on the forehead and on the skull, infected and rotting tissue, rotting gums, memory challenges, green scaly skin. I'm going to show you a picture there. If you go out and Google crocodile, you'll see it's just nasty. I didn't want to totally disgust you with the pictures, so I only have one that I showed you, but this gives you a good indication of the crazy green-like scales and the eating away, the flush eating disease that happens from this. So thank God, crocodile is not a common drug in the US. However, it is used widely in Russia, especially amongst young people. It is cheaper than heroin. It is a man-made form of morphine. And again, it is about 10 times stronger than morphine. And in addition to the morphine being in there, it is this combination of chemicals, including codeine, iodine, gasoline, paint thinner, lighter fluid, and other unknown chemicals, a whole assortment of them. So users, they inject it into the bloodstream. It has this rapid, short effect, and it's also sometimes spelled with a C as crocodile. So it's an opiate, and obviously the effects, it gets its name a crocodile because of the effect that it produces on the skin. So there's a greenness that happens, and the blood vessels get damaged, and the skin gets scaly over time. Tissue damage can lead to gangrene, and it can result in amputations or death. They call it the skin-eating disease, if I didn't already say that. So obviously, addiction is a huge problem with crocodile because of its high potency and its short duration. And then people want to use it over and over and over, this kind of binge pattern type of using. Oftentimes, one of the noticeable things besides the physical challenges with it is that folks they're exhausted, malnourished, sleep deprived, memory loss, problems with speech, and the recipe, it's homemade, and that's one of the reasons why it is so cheap. It's crazy. So moving on from that, LSD, like MDMA, is a drug that is being used both. It's an illicit drug, but also there's a psychotherapy use that's being used to help people with PTSD. So LSD was a drug that became popular in the 1960s and is still commonly used today. It's made from an acid found in fungus that grows on rye and other grains. Now, some of the common side effects of LSD you can see right here on the picture. And while you're looking at that, let me tell you that LSD is also called acid, blotter, doses, hits, microdots, sugar cubes, trips, tabs, and window panes. And one of the reasons for that is that you often see LSD in what's called microtabs. So it's a hallucinogen, obviously. And some of the side effects is that you'll hear and feel things that seem real, but they're not there. And that's where that term trips came from. I'm tripping, man, came from using LSD. LSD can cause physical effects such as the dilated pupils, increased heart rate, increased blood pressure, sweating, loss of appetite, dry mouth, and shaky. Moving right on, marijuana. So marijuana, I'm not, so understand I am not taking a side one way or the other on here. I'm presenting an informative dialogue about street drugs. Marijuana is still the most used, considered to be by the government, the most used illegal street drug that is out there. And of course, in many states, including South Dakota, it has earned the right to be considered for medical purposes, although I don't think it's been passed officially by the governor here yet, although people voted it in. So marijuana is the dry leaves and the flowers and the stems and the seeds of the cannabis sativa plant. And most people smoke marijuana, but it can be used, added to foods and eaten. It's also called blunt, bud, dope, ganja, grass, green herb, a joint, Mary Jane, pot, reefer, skunk, smoke, trees, weed, hashish, boom, hash, and hemp. So interesting thing about marijuana is that it can act as both a stimulant and a depressant, and at times even a hallucinogen. So the marijuana contains this chemical called THC, and THC acts in different parts of our brain, and that's why for some folks they get a high, and it changes those moods and their body movements and their thinking and their memory. And then when it's used regularly, it can affect the brain development. It can lead to cognitive problems. It can become addictive for some folks. It can also cause some serious problems if you're smoking a lot of it, such as breathing and increased heart rate and things like that. Many folks have used it to assist with challenges such as schizophrenia, mental illness, limit nausea from chemotherapy treatment. Other folks have found great success with it when using it for challenges with like Parkinson's. Any questions that you need to interrupt me for? How are we doing, Stacy?
Good, but I have a quick question to go. I don't want to backtrack too much, but whenever you were talking about LSD, like how long is your quote trip? Like how long does that last?
It really depends on how much you're taking and who you are and what your level and tolerance is. For some folks, it can be, a short period of time, about an hour. For others, man, they can trip for a long time. Just depends.
Okay, thanks.
Mm-hmm. Okay, we've talked a lot about meth, and in these presentations, I did an entire presentation on meth. So for those of you that may not have been there for those, this is just a quick overview. Methamphetamines, also known as meth, crystal meth, chalk, crank, and ice. It's a stimulant. Meth is a white powder that folks use. They'll swallow, they'll smoke it, they'll snort it, they'll inject it, and it's made from a combination of drugs that are often common ingredients in like cold medications and sinus medications, things like that. So like I said, it's a stimulant. It is highly addictive. And the reason that it's highly addictive, as we've talked about a lot of the others, it gets right to your brain, and the brain says, dude, I want more. And the high fades quickly, so then you want to do more. And the more you do, the more you want. The more you do, the more you want. And of course, the physical effects are super similar to cocaine and other amphetamines. You get that increased breathing and rapid heart rate, high blood pressure, increased body temperature. So for folks that have been doing just a boatload of meth and on it and on it and on it, and they haven't been eating and they haven't been sleeping, their body temperature can rise. And when their body temperature rises and the organs are getting all fried out, the brain's getting fried out, that's where you can get a stroke or even a heart attack. End up with skin sores. And of course, the skin sores often come from folks thinking their skin's itching and they think that they've got bugs underneath there, or they'll feel like their skin's crawling and they start digging at it and you get the sores. And because they're up all night and using this all the time and they're not eating, they're not taking care of themselves, not taking a shower, you can get skin diseases as well. Dental challenges. This is where meth mouth comes from. Folks on meth, folks on methadone, you can look at their teeth and their gums, and the teeth are rotting, and it's painful to look at. Of course, chronic users of meth, you get the typewriter mouth, their teeth are moving fast, and anxiety and confusion and hallucinations and insomnia and depression and paranoia. And with folks that are injecting it with a needle, of course, there's the high risk of acquiring HIV or hepatitis from sharing the needles. When used during pregnancy, it can cause a spontaneous abortion, birth defects, and the baby can be born addicted to it. So I promised you mushrooms. So shrooms, you can see the shrooms in the back. Mushrooms, also called, so psilocybin and peyote mushrooms are eaten, brewed in a tea, or added to foods to get high. And again, because we had the comment earlier, I want to preface that peyote, like some other substances, are used in different cultures for sacred ceremonies. And with the use of some of them, depending on how much people use, you can get hallucinations out of it. They're also called boomers, little smoke, magic mushrooms, shrooms. And the active ingredient in it is what causes the hallucinations with certain types of mushrooms. The effects typically will start within about 20 minutes of using it and can last as long as 6 hours, very similar to LSD. And also similar to LSD, you can have that altered sense of perception, an inability to tell the difference between what is real and not real. I will go off script here and say that some folks that use it, similar to ayahuasca, will talk about being able to be in both the seen and the unseen world. And of course, using high doses for a long time can cause a panic, a psychosis, flashbacks, also extreme pupil dilation, nausea, and vomiting. I will tell you, I have friends that sell mushrooms. These are legal mushrooms, and they're used to combat the same things. They're used to combat nausea and vomiting, help some folks gain weight, treat people with anxiety. The challenge is that nature has presented us with these natural items, and they've gotten mixed in with these other illicit synthetic drugs and all combined together. I'm not sure that we have the smartest drug policy by any means in the US. I will say that. Salvia. Salvia is an herb, and this herb is often found in Mexico. Folks chew it or smoke the leaves, and it's in it's not uncommon for it actually to be grown in a pot, but often grown in fairly damp areas. It's also known as diviner's sage, magic mint, Sally D, seer sage, shepherdess herb. So this herb, it's in the mint family, and primarily it's found in southern Mexico. And this mint changes the chemistry in the brain at times, causing hallucinations. And the effect usually lasts less than 30 minutes. For some people, it can be very intense and frightening. And it's important to tell you, it is not illegal according to the federal law. However, several states and countries have passed laws to regulate its use. The DEA in the US lists it as a drug of concern that poses risk to people who use it. When I presented this, I wanted to give you a good viewpoint of things that are considered illicit drugs, street drugs, but as I hope that you can ascertain from this, that there are some powerful herbs, as with anything out there, that there's some great benefits that people gain from it as well. So let's get into Spice K2. So this is something that is a challenge out in the community. So Spice or K2, it is a synthetic cannabis. So it's human-made, mind-altering chemical that is sprayed on dried, shedded plant materials so that they can be smoked or sold as liquids to be vaporized and inhaled in e-cigarettes and other devices. Keep in mind, this is man-made. It's synthetic. So the recipe for it is not consistent. It's often known as herbal or liquid incense. They're similar to THC, but because it's synthetic, or known as, Spice and K2 is actually known as fake weed. It's often marketed as being safe. It's actually more dangerous than most any marijuana that's out on the market because it's unpredictable what's inside it. And it can be dangerous and life-threatening. And there's a new class of drugs, a new group of drugs called NPS, known as new psychoactive substances. NPSs are unregulated, and their new ones are frequently being brought to the market.
Is that what that kratom would be?
Could be.
Although I don't think it's synthetic.
Kratom?
Yeah, well, maybe we'll have a discussion about that sometime.
Okay. So the last one that I put up here is what is very frequent in our community right now, especially amongst our young kids, known as wax, honey oil, sap, butter, shatter, or dabs. And you can see it right here. And it's not uncommon. You'll see dabs. You'll see it on little pieces of paper, right? These drugs actually were accidental. And as people tried different drugs and different plants and added different minerals and everything, they found that some of these had beneficial effects, right, that we've talked about, but there was a way to fast track them. In other words, you could create it, distill it, and distribute it out as a super addictive drug. And that's where shatter came from. So shatter it depends on what community that you live in, and what name it goes by. Here in Rapid, most oftentimes it's known as wax or dabs. It's basically butane hash oil, BHO. It's a new marijuana concentrate, basically. It gets its nickname due to that very brittle texture that you'll see. and dabs or waxes, they take little small amounts of the extract and they dab it onto like a heated surface and then inhale it or smoke it. So it's mixed with natural plants, and then of course chemicals are added to it, and literally it's at an explosive results, right? And that's where basically the name Shattered comes from. So it has psychoactive properties such as marijuana because of the THC, but it's more potent because there's this exorbitant amount of THC that is contained within it. So it has like 60 to 80% more THC in this dab, in this form that it comes from, than in smoking a whole joint. People use it because they can get high faster. It's cheap because it's just a little bit on a piece of paper or some type of plastic. But what happens is there's this overwhelming paranoia, anxiety, and even psychosis that comes from it. So that gives us just a really brief overview of some of those street drugs that are out there. How about questions? Any questions out there, Brooke?
I don't currently see any coming through quite yet.
All right. That is what I have to share on the street drugs today. What I'd like is maybe we can open, I don't know how many folks are actually on the Zoom. Let me open this up. So
we have about 40 participants, and I don't know, Haley, do we have anything from the HHA page? Any comments or questions?
No, nothing that's come through.
So here's a question I'd like to put out there to folks, and these 40 participants that we have. I'm really curious as to what are you seeing in your community? So I see that Selena Steele, you have your hand up. Would you like to, I just allowed you, let's see. Selena, would you like to speak? I see your hands up. You can unmute yourself if you want. So Tina has a question about how recent are the statistics? And what statistics? Oh, Selena says no, she didn't have a question. Tina, do you want to talk? Would you like to speak? What statistics are you referring to? What I'm going over and presenting. So, most of the statistics are fairly recent. I try to get the most recent statistics that I can. It's hard to take statistics. In Indian country, we don't do a really good job of collecting data, unfortunately. It's not necessarily on us, it's the data that is collected is not always the most accurate. So Brooke says, I realize how sheltered of a world I have grown up in and lived in. 27, have heard of like 4 of these, mostly from movies. Thank you, Annie. It's been very informational. Yeah, you're welcome. I looked at all the drugs and the street drugs that are out there, and I tried to pull out the one that are more common in our community and that maybe folks hadn't heard of. We have other drugs that are out there, such as like GHB, right? And GHB is a synthetic depressant. It's used for sleep disorders in some countries. It was banned in the US because of its dangerousness. GHB is often known as like G or liquid or caps or scoop. It's clear, it's liquid, and it's usually mixed with alcohol. It's oftentimes known as the as a rape drug because it's put into people's alcohol if they're drinking, and the date rape drug. And victims don't notice it. You can't smell it. And it affects everybody differently. But initially, it's like a euphoric and relaxation. So there's all these different drugs that are out there. So if there's no other questions, I think this is what I have for today. Unless you have anything, Stacy, any other questions?
I don't have any more questions. I do have a link to the survey that we would ask you to please complete. And I'm going to put that in the chat box. And this time I need to make sure it goes to everybody and not just Brooke. And please indicate the session, Street Drugs Exposure to Drugs. And invite you next week when we're going to have Josie Dutch from, she's from Indian Health Service up in Aberdeen, talk about opioid awareness and Narcan administration. That'll be at the same time, same link next week. Remember that you can receive CEUs for each one of these presentations. If you need the form to complete for CEUs, please let me know. I actually watched a training yesterday and every other word was so I'm trying to be very conscientious of not saying and those kinds of things. So I apologize if I do that. Annie, I want to thank you for providing a very informative session to us. And I learn something new every time we have a conversation. And I'm so thankful and so honored that you would always come to my rescue and be here to provide it, share your information with us, because you're just a wealth of knowledge.
Oh, thank you. I just want to, I guess I want to wrap up with you all as we still have so many folks on and say, drugs are scary, right? And trauma's scary. As Dr. Darrell says, trauma sucks. And feeling overwhelmed sucks. It's rampant. It's rampant within our communities. It's rampant throughout our nations. And so many times I hear from folks day in, day out, how powerless people feel in trying to help folks. And what I can say, what I'd like to offer to some of you is to say, man, get as informed as you can. We have presentations by Dr. Darrell Tonema on the Great Plains Tribal Leaders Health Board website. I am always happy to sit down and have conversations with people. I want to remind you though, I was on a conversation yesterday and somebody said, where's the brochure? Where's the book on how to heal from all this? It's inside of us, and it's inside of our elders, and it's within the wisdom and the teachings of our culture. And the simplest things are the things that are going to really help us heal. The simple things like finding a way to plant our feet on the ground and remember how connected we are to Unchi-Maka. To drink water, right? Drink healthy water, take a walk every day, eat some healthy food, have a good conversation with folks, take the time to build relationships. And when it gets uncomfortable, be willing to lean in. We talk about that being turtle medicine, that openness of our front, a soft, open heart and a strong back. And being willing to lean in, making sure that we're walking with our shoulders back, our head held up, taking a deep breath, feeling our feet connected to the ground. We have the ability to walk through this. And when we think that we don't, take a deep breath and reach out to one another. So be kind to one another. Thank you for this opportunity. Thank you, Stacy and Brooke and Hallie and all the folks over at Great Plains Tribal Leaders Health Board for all your support and assistance. Be well, friends. Take good care, relatives. Thank you. Miigwech.
Thank you, Annie, and everybody for participating.